Welcome. My name is Denise Stewart and I want to share with you a preview of my ebook, Courting a Self-Assessment Guide. This guide is for women who've had breast cancer and who want to understand more about their body, how their body has responded to breast surgery and radiotherapy, and especially how their arm movement has recovered. One of the most common reasons for impaired arm movement after breast surgery is cording. Cording is also known as Axillary Web Syndrome or AWS. Let's refer to the problem as cording because it's much easier to say and actually describes the problem more accurately, as cording can present as very tight bands of tissue that develop almost overnight, and the pain makes it impossible to get full arm movement. I developed this guide to help women take the steps required to assess their own arm movement and to be able to assess if tight tissue is restricting their recovery. This ebook was inspired by the large number of women who came to my clinic having no idea about what cording is, and in many cases they didn't even know that they had cording. Yet they did know that their arm movement was just not quite right after breast surgery, and they expressed a clear lack of confidence with who to speak to about their post-surgery pain or persistent arm stiffness. My patients happily volunteered their photographs to this ebook to help inspire positive actions for other women. So before we start looking at what is in the ebook, let's talk about how this ebook ends if you purchase it. I see 4 different endings. The first one is that you purchase the ebook, Courting a Self-Assessment Guide, and it sits on your computer and you don't take the test. Well, you've just sponsored me for the work I do in developing resources for women after breast cancer. You may even be able to share your current knowledge about cording, and that is that there is a self-assessment guide, with at least one other woman who needs to know this. The second ending is that you take the test and both arms have great reach and stretch, and at each test position, your right arm and left arm move and stretch exactly the same. Perfect. You can be confident that you have double-checked and that all is well in terms of your arm movement recovery. The third ending is that you take the test and your arm movement on the side of the surgery is not nearly as good as the movement on the other side. Maybe the tightness you felt was cording, and maybe it was other structures that just got tight following your surgery. You will then make some positive decisions about who you will talk to get help with your recovery. The fourth ending, which is my favorite, is that you do the tests, you either find tightness or not, but you use this test information to pass on to other women who have survived their breast cancer. You talk to them about the arm to ear test, and you talk to them about the reach out the back test. This may be just the incentive that they need to take the action required to recover well from their breast cancer surgery. Now you know how this ebook may end. Let's see what is covered in the guide. You will see the latest and most comprehensive tests for cording. You will learn about your body's response to breast surgery. You will be able to feel or see tight tissue if it's present. And you will read about the steps to get the help you need to recover. There are many different types of cording. It can be thin, tight strings, it can be thick, rope-like, or it may be really thick bands. The cording may be in the armpit, elbow, wrist, or below the breast. I describe 5 common reasons why cording may not be accurately assessed. This is so women can understand why their cording may not have been diagnosed. I believe the main reason is that cording cannot be picked up in a blood test, and the test is reliant on health professionals seeing or feeling the cording. So the reason for cording not being accurately assessed may be as simple as the health professional not testing for cording or not using comprehensive tests to see or feel the cording. I describe 5 myths of cording, as this has influenced assessment and treatment for cording over the years. The top myth has been that cording will disappear in 3 months. This is definitely possible. For many women, the pain does reduce and the cording does soften, but for some women, the tissue remains tight enough to restrict full recovery of arm movement for years. Knowing about the myths will help women understand some of the barriers they may face when accessing services for the assessment and treatment of courting. The first test for courting is the arm to ear test. This test is done while lying on your side. There are 3 steps in this test. There are examples of how and where to feel for tight bands. There are photos showing what courting can look like, and there are photos showing how courting cannot be seen in one step but is clearly seen in another step. There are also photos showing how to stretch the skin at the armpit to see if the courting may be present, but just a little harder to see or feel. Once this test has been completed, you will be guided to whether the second test, Reach Out the Back test, is suitable or required. The Reach Out the Back test is a new assessment I've developed for courting. This test requires far more stretch of the chest, skin, muscles of the chest, and the courting tissue. The Reach Out the Back test is first done with the arm opposite to the surgery. This allows you to assess your arm movement and then be able to make a good comparison when you do the same test on the side of the breast surgery. There are 3 positions to take the test in, and each position is clearly described, and arm positions are shown using photos. There is a photographic example of Reach Out the Back test comparing the reach of the right arm in these 3 positions with the reach of the left arm. There are also photos of what courting can look like in this test. My favourite photo series is on page 27, where you can see the progress of a woman where courting was so severe at 10 days after surgery, she could not raise her arm up to shoulder height. The photos at 4 months and then at 1.5 years show her improvements with her treatment program. This woman was definitely not able to do the Reach Out the Back test initially, however was able to progress to this test over time. There may be other reasons that arm reach may be different in this test, and photos show examples of muscle tightness and skin tightness, which is different to courting. Once the test has been completed and the reader has seen or felt tight tissue that can be courting, then the next action that is required is to get a professional diagnosis and a referral for treatment. The reader is advised to collate their home assessment findings so that they can confidently approach their health professional at the breast care clinic. There is a summary sheet at the end of the book that can be used for this process. For women who want a little bit more detail about courting and rehabilitation, there is a brief reference to the latest research, potential barriers to rehabilitation services for women after breast cancer, and a link to the case study project, Share Courting Protocols. This project is supported by experienced therapists across the world, providing services to women with post-breast cancer courting. The case studies describe treatments and provide real examples of timeframes for improvements with photos supporting the improvement. At the end of the ebook, there is a 1-page guide to the steps for both tests. This allows women to print this page and take it to a comfortable place in their home and then start and complete their in-home assessment following the steps for each test. So if you choose to purchase this guide for courting assessment, which ending will you choose? We hope that you are inspired to take positive action to help yourself and to help others.